I found that working with Scotland Family Medicine and Dr. Ken has been a world of difference between what we used to know, where we would need to call the doctor and we would typically have to wait a number of weeks to get an appointment to see them. The wait times at the doctor's office would be extensive. The time with the doctor when they would finally come into the room would be minimal, very short, very brief, and they would send us off on our way. And the whole experience took a lot of time, and I didn't leave there really feeling like I was cared for. And that was probably the biggest difference with Dr. Ken and just going into his office. It's a little bit like what I knew it could be with my uncle as a surgeon and as a personal doctor. But the second I stepped into Scotland Family Medicine, it was just very different. The welcome room and reception was warm and friendly. His whole staff is just very personal. They know us by name when I call and when I email and stop in. Our family loves everyone here, and I could just tell the level of comfort. It was a very different kind of care. It was very personal. And then Dr. Ken comes in the room and would typically spend as much time with us as we need to. Would always spend as much time with us as we needed him to, and more. And it was just a very different experience when we would leave kind of our old doctor's office, and then when we leave our first experience with direct primary care. And it's been excellent beyond the office visits. Life is all about convenience, and I would say that that's applicable in our busy lives. And as we've traveled a number of times or preparing to travel, and everyone's starting to get run down and not feeling so well, or we're sick on the road, I could call Dr. Ken or shoot him a text, and he would be able to offer us either advice or, medicines called in or here at the office. And I would say that that's probably the biggest convenience for us is the cost of direct primary care has almost equaled out those visits when you're sick or you're on the road and you need to stop at a Doc in the Box or Medical Express type scenario. What you pay there with a medical copay, even insurance copay, is sometimes more than what you would pay for direct primary care, and you're getting a whole sense of membership, a whole sense of family, and just real true medical care.
Well, with direct primary care, it's a whole lot different than it was for fee-for-service. We live in a world where everything's based on our convenience and how accessible things are to us. The entire internet is accessible, on our smartphones. And we've always taken a route that after hours or on a weekend, when we have a sick child, what's most accessible to us is an urgent care or an emergency room. And if you think about how that unfolds, is you get to pack up in the car and you get to go to the emergency room. You get to wait for hours sometimes in a waiting room surrounded by people with very questionable stages of health. And then you get corralled into a little cubicle that's covered by a curtain where you get to wait for the nurse, then you wait for the doctor, then you wait for the lab tech, then you wait for the results, and then you get the privilege of paying a $300 copay for that accessibility. True story, this past weekend, my daughter exhibited signs of a urinary tract infection. So I went to the drugstore and bought her a test kit and some pain meds. And so we came home and we tested, and sure enough, she tested positive. So I gave her the first dose of pain meds, and I texted Dr. Richter. And I told him what was going on. And all they had to do was call in the script for me, and I could go to my local pharmacy and pick it up. That's accessible. So for anyone who thinks that the traditional primary, your primary care doctor is inaccessible, or it's just not fitting for your needs or your sense of urgency with your child, I think it's time to turn that page, because your primary care physician can be as accessible as that very smartphone that you're using to find the rest of the world. So I would have to say that there's a huge difference in how accessible my doctor is to me and the level of care I get from my doctor, because he can spend more time with me than I ever had with paid for service.